Welcome to Mind Your Mental Health channel, a channel for mental health awareness, psychological health, and well-being. This is our 18th episode. So far, we talked about mind, the concept of mind, how does it work, where it belongs, and we also touched upon mental illnesses. In fact, in the last episode, I gave an introduction to the mental illness. What is mental illness? And how we come to the conclusion that this is mental illness. In this episode, in the 18th episode, I'm going to talk about types of mental illness. In other words, we can say diagnosis and classification of mental illnesses. There are many mental illnesses diagnostically, hundreds of them. And we make an assessment or examine a patient and then come to a diagnosis. So diagnosis is a very important aspect of our service. Whether it's a psychologist, psychiatrist, or whoever is a health professional, mental health professional, they do make a diagnosis. But there are few different views about diagnosis. We'll come to that a little later. Let me first explain about the diagnosis. Diagnosis is a common word. It used to belong to the medical field predominantly, but we use that in different fields. For example, if you take your car to a mechanic and there's a problem in the car, he makes a diagnosis, what is the problem? Similarly, a patient comes to us, we ask questions, we observe them, we listen to them, and we might administer certain tests, probably psychological tests, and certain questionnaires, and then we come to a conclusion, this person is suffering from this particular disorder. That process is called assessment. End of that process leads to a diagnosis. Okay, the next question, what is diagnosis? It is a process to recognize and name exact character of a problem or a disease, and which we arrive by examining a patient. It could be psychiatry, it could be cardiology or neurology, wherever it is. A patient is examined and look at the common characteristics of a particular disorder and then declare this is a disorder. For example, patient comes to us in a general hospital setup, patient comes to us with a symptom of cough. And then we ask more questions and then find out, okay, this is the diagnosis. Okay, you're suffering from bronchitis or infection of the chest. So then we give treatment accordingly. Diagnosis is also a process for identification of any particular problem and its nature. That's also a diagnosis. These are few kind of definitions of a diagnosis. So why do we need diagnosis? Do we need a diagnosis? It's a good question. Can we offer whatever we are offering without the diagnosis? And diagnosis is what we call as a clinical shorthand. I'll explain to you that. Why it's a clinical shorthand. The moment a doctor or a health professional says that this is a diagnosis what you have, that brings in a lot of information about the nature of that particular problem, extent of that particular problem, and probably the treatment and the prognosis. When we say prognosis, I'm talking about outcome. Whether they'll get well in a week's time or it might take more than that, probably 6 months, or they might have to continue treatment for lifelong. Everything is put in a small title, the diagnosis, and once we say that diagnosis, the patient might understand what it is. I'll give an example. For example, patient comes to me, it's a general hospital setup, general health, and gives me lots of information. I ask a lot of questions. In the end, I tell the patient, you're suffering from diabetes. Diabetes is your diagnosis. The moment I say that, most of the time, patient will understand what it is. They might understand it is related to the sugar, it is related to the glucose, it is related to the carbohydrate or something like that, with their general knowledge or general idea about that particular illness. So instantly it conveys what exactly is the problem. So that's why we say it's a clinical shorthand. This is for the patient. For the other fellow professionals, suppose I am referring this patient to say a cardiologist. because due to the diabetes, patient has cardiology or cardiac complications. When I refer the patient, I say in my letter, I'm referring so-and-so, age such and such, and recently I have diagnosed with the diabetes, and he has these problems. That's why I'm referring you. The moment the receiving doctor, the cardiologist, looks at the diagnosis, it conveys a lot of information to him. It conveys information, okay, this cardiac problem could be due to complications of diabetes. And doctor has already examined and come to the conclusion that this patient suffers from diabetes, and he also went further and assessed the complications of diabetes, and he thinks that patient has cardiac problem. So that's why we say it's a clinical shorthand. So instantly we are able to convey the whole information about the patient. Of course, the cardiologist will ask more questions and confirm the diagnosis, and then go ahead and look at the cardiac or heart problems. Okay. And not only that, it also conveys appropriate treatment for that condition. Once I make a diagnosis of diabetes, I will give a treatment for diabetes. So it all comes in a package, you know. So I can't make a diagnosis and give him a treatment for hypertension or high blood pressure. So the once we make a diagnosis of diabetes and we know what exactly is the treatment. That is another advantage of making a diagnosis. These are all some of the clinical advantages. Now, professionally, health professional will have all these advantages, and of course, the patient also. There are non-clinical use of diagnosis. For example, as a government, as a policy maker, I want to develop a service. Then I need to know in my population, there are about 300,000 persons in this area, and out of these 300,000 persons, I need to develop health services. Then I need to know what kind of a diseases are predominant here. So then we do a survey or epidemiological studies, and then we come to a conclusion. Disease A, B, C are quite common in this population. Then I can plan my health services accordingly. I can do what I need to do to prevent these diseases. For example, diabetes, hypertension, what we call as a metabolic disorders. And I can do something about improving the general health and exercise and diet management, all those things I can offer as a preventive measure. That is health planning. And I can also bring in more specialists in diabetologists so that many people get benefit out of it. So it is also helpful in planning the services, health services. And it is also useful in legal system. There are some kind of a situation where we might have to tell the judge that this patient suffers from this disorder, this could have happened because of this disorder. So legal systems would require a diagnosis from a doctor or a medical expert opinion about the particular illness. And also, it is also helpful in offering social services, benefits and other things to the patients. Suppose I make a diagnosis of a particular disorder which has a high incidence of disability, where patient cannot function normally. Normal day-to-day function the patient is not able to carry out. That diagnosis help that person in getting whatever disability benefits or whatever support system available in the community. So that way, it is also helpful in non-clinical purposes. Another important aspect of the diagnosis, it helps in research. If you want to find out why do this community of 300,000 people have a particular disorder more compared to any other county in this area, then I can do a research on that. I can collect data pertaining to that particular disorder, and then I can come out with results of the research. So it also helps in research. Okay, those are all the points for making a diagnosis. Let's see why people are against making a diagnosis. It's quite simple, isn't it? Quite clear that there are many benefits for diagnosis. Then why people go against that? Why people say that no, you should not be making a diagnosis? Let's come to reason for that. Now, especially I'm talking about mental health in psychiatry. In psychiatry, many things you might have observed when we had seen our other episodes from episode 1 to 17, how subjective is mental health problems. Suppose I come and tell you I'm suffering from depression, I can only explain to you. I can't make you observe that. Of course, I can look at the way you look, way you talk, all those things help me, but the subjective phenomena I can only verbalize and you will only infer from what I am telling you. I'll give you another example, better example. There is a symptom called hallucinations. Hallucination is hearing voices or sound which is actually not there. So if I'm hallucinating, I'm hearing voices when nobody's around, or even somebody's there, nobody's talking, I hear voices to me only. This is hallucination. Suppose a patient comes and tells me, I hear voices and voices talk to me continuously. There is no way I can objectively do a test and find out actually patient is hearing voices or not. We'll have to go by what the patient says. Of course, we match it with what information we have from what we learn, what experience we have. All those things adds up together to say, okay, this patient is really having the symptom of hallucination. So that's why we call psychiatry or mental health as a very subjective phenomenon. I used to say psychiatry is an art, or it is a scientific art. So that is one of the major problem in diagnosis. Even if everything is subjective, there is nothing objective, where is the validity? Person can question, have you done any test which gives you a diagnosis? For example, I quote an example of diabetes. Once I make a diagnosis of diabetes, I'll send the patient to the blood test. And I'll ask for certain blood tests, blood sugar level, all those things. And then I'll say, okay, this is your blood sugar level. This confirms that you have a diagnosis of diabetes. In mental health, we don't have that kind of a blood test or X-ray or a scan. That's why the question is, what is the validity and reliability of this diagnosis? And another problem we encounter is most of the symptoms are overlapping. I gave an example of hallucination, hearing voices. This can happen in psychotic individuals, psychosis. For example, a diagnosis called schizophrenia. It can also happen in a diagnosis called mania. It can also happen in diagnosis called depression, when there's severe depression with psychotic symptom. So the symptoms overlap from one diagnosis to other diagnosis. That makes it difficult to make a kind of objectively do any test. Okay, and not only that, many of the sociologists would argue the diagnosis, a label, what we are giving as a diagnosis, carries stigma. The moment you make the diagnosis, that carries a lot of stigma in the public. We haven't completely got rid of stigma. Yet even now, we have a lot of stigma about the mental illness. So why do you want to label them? There is no need to label them. Okay, that is another point. And another point which is kind of usual, quite often stage against the concept of diagnosis. In the past, it could be happening even now, in some of the parts of the world, a mental health diagnosis used politically to control people, to silence voices, put them away, telling they are mentally ill, what they are talking is nonsense, and put them away, incarcerate them. So that is the geopolitical issues. So diagnosis can be used in a wrong way. Okay. So if you say that diagnosis is not a good thing, then what approach we can take? We can ask the people who are talking against diagnosis, okay, what else we can do? They come out with two suggestions. One is focus only on symptom. Manage only the symptoms and the strengths of the patient. So patient has this, all the symptom patient has, for which I will manage the symptom. These are the positive things patient has, these are the strengths patient has, I will enforce that, I will promote that. That is one way of doing it. And also they say it should be patient-centered or person-centered. moment we make a diagnosis, give a label comes to the forefront. Sometimes clinician might forget a person behind that label. So their focus will be on diagnose and the disease. They may not fully understand the person behind that, because each person is different, even though label is same for hundreds of people. So I make a diagnosis schizophrenia for hundreds of person. Each person is different, because that diagnosis is only a label. It tells us what are the problem, but the problem can create individually different situations and individually different experiences. That's why they say it should be person-centered, and it should not be naming or labeling. So we can combine these two actually, because diagnosis so many good kind of pointers. So what should be happening, or what is happening, is we do make a diagnosis, but we make it's a person-centered. We make a diagnosis and then look at that person, what is the need, what can be done, and also elicit information about strength of the person. In spite of suffering from this kind of a problem, mental problem, how you cope, what are the strength, what are the positive aspect, what we can support, what we can improve. So when we combine these two concepts together, then it becomes a powerful tool. At this point, world over, diagnosis is an essential part of any medical practice or health practices. Okay, we talked about what is diagnosis. We talked about pros and cons of diagnosis. Next, let us look into classification. Classification of diseases and disorder. Let me talk about generally classification. What is classification? As the name suggests, classifying a group into smaller group, a larger group into smaller group, so that we can understand the process and we can understand everything about that particular group, and also it makes it easier to approach the whatever characteristics we are given to the individual groups. When it comes to mental health, there are hundreds of diagnoses. There are hundreds of diagnoses. We need to classify them into smaller groups so that we understand better, and we are also able to communicate better. There are a number of classificatory systems in mental health. There are many number of classificatory systems. I'm going to talk about only one particular system which is practiced globally. In fact, there are two popular systems. One is called ICD. ICD stands for International Classification of Diseases. And it is called ICD-11 now. The 11 stands for number of revisions. Roughly every 10 years, this ICD, this classificatory system, goes to revision. They do a number of field studies, research, and take in data available from different research happening all over the world, and then try to look at the classification again. And they might delete some classification, they might delete certain classification or certain terms. For example, homosexuality used to be under the classification as a disorder. This is several years ago. In one of the revision, they realized that that is not a disorder. So they removed that disorder from the classification. That's how the classificatory system works. The new knowledge comes in, we understand certain thing, and we realize certain thing. Then we say, okay, this is not the diagnosis. We need to take that off. Likewise, certain diagnoses might undergo certain changes over a period of time. So we have international classification of diseases. That is a WHO document, World Health Organization document. It's a very kind of a old process. Actually, classification of diseases started somewhere in 17th, 18th century. And from 1948, WHO took on that task, and since then they were doing the classification of diseases. Now this classificatory system is followed all over the world except America, United States and Australia. They have different classificatory system that is called DSM. Now I'm going to talk about ICD because United Kingdom follows ICD, like the rest of the world. And this classification system has 20 subheadings. So all the mental disorder are divided into 20 subgroups. I'm not going to talk about all the 20 subgroups in this episode. I will touch upon some important subtypes or subgroups, and then when we take up individual disorders, I will discuss further. For example, the group 1 is neurodevelopmental disorder. Basically, they are talking about autism and ADHD. Autism is something which is developmental. It's not something which develops after I have reached 20th year. It is something which develops from the younger age, much early days. It's a developmental problem. So that is one cluster or one group of type of mental illnesses. Second was schizophrenia. Schizophrenia is a psychotic disorder. So they clubbed schizophrenia and other psychotic disorder together and called it as a schizophrenia and other psychotic disorder. Catatonia is another group. Mood disorder, another important group. If you have listened to our previous episode on mood or on mind, I would have talked about mood. So mood is very subjective and it is there in everyone. It fluctuates, goes up and down within the normal limit. Sometimes it can go very high, become abnormal, very low, become again abnormal. High is called mania, low is called depression. This is grouped together, all mood disorder to group together and classified as a mood disorder. So next is anxiety disorder. There are a number of anxiety disorder, phobia, generalized anxiety disorder, panic disorder, PTSD. All those things are clubbed together and called as an anxiety or fear related disorder. Then we have obsessive compulsive or related disorder. Obsessive compulsive is the thought which comes back again and again, and that thought makes the person to do a ritual. It could be washing, it could be counting, it could be checking. This is obsessive compulsive disorder. A bit of information here. In a previous revision of ICD, International Classification of Diseases, OCD or obsessive compulsive disorder was clubbed together in anxiety disorder. It was under the anxiety disorder classification. In the past 10 years, or more than 10 years, there are certain research data, there are certain field work, data from field work has led to the conclusion that it should be classified separately. It's a group of disorder by itself. Okay, so that is OCD or obsessive compulsive disorder. Like that, we have number of other groups or 20 groups. Another important group is personality disorder, where from the younger age, the development of personality changes, they go into different personality disorder. There are a number of personality disorder. Most commonly we see in our day-to-day practice, emotionally unstable personality disorder, or in abbreviated term it's called EUPD. And dissocial personality disorder, anancastic or obsessive personality disorder, these are different personality disorder. Then we have childhood disorders. So this is the ICD classification. There is another way we can classify mental illnesses, that is according to the age. Child and adolescent mental disorders, adult mental disorder, and old age mental disorder. There are different ways we can classify, but the classification system officially followed by United Kingdom is ICD-11. Okay. In this episode, we discuss about diagnosis, what it is, why we need it, what are the pros and cons of it, and how we can practice a diagnosis. Then I talked about classification. I touched upon what is classification and different classification available and what is currently available in United Kingdom. So this concludes our short 3 episodes about mental illnesses in general. Next, we are going on to another important group of or important episodes where we'll be discussing about individual disorders, individual mental illnesses. This can go on for 30 or 40 episodes. We try to cover all the possible common mental disorders in this channel. Next episode, I will talk about depression or what we call depressive disorder. We will talk about what is depressive disorder and how common it is and what are the signs and symptoms and probably what is the treatment of this disorder, what is the prognosis, all those things we will discuss in our next episode. Thank you for being with us. Do visit us again. Do share with your family and friends these channel details, because what we are giving is a very important information about mental health. So please do subscribe to our channel. Please do share it with others. If you have any comments, do pass the comment. Thank you.